season's greetings to you all. Before we begin, I would like to recognize that Dalhousie University is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for over 400 years. As we head into the busy holiday season, December in the Maritimes looks much different than it did last year. Public health measures in response to the COVID-19 crisis have been inconvenient for us all. Yet, as this year comes to an end, there is still much we can be grateful for. At Dalhousie, we have experienced growth, achievement, and new challenges over the past 12 months that we can all be proud of. Thanks to the actions and ingenuity of many, all education programs have fully resumed, albeit predominantly in a virtual format, and our research programs have been able to continue. To our clinical faculty, residents, public health, and first responders who have been facing the COVID-19 pandemic, thank you. We deeply appreciate the sacrifices you and your families are continuing to make to keep our communities healthy. Thank you as well to the Dalhousie students who have been volunteering to provide assistance to frontline healthcare workers and other supports to the regional health system. I continue to be impressed with and be proud of the Dalhousie Medical School's community's response to challenging times. We are also grateful for the dedication of our scientists who have been working in the COVID-19 related fields to develop diagnostic, therapeutic, and preventative strategies for managing the devastating infection, along with determining the societal impacts of living through this pandemic. Despite the challenges presented by the COVID-19 pandemic, Dalhousie Medical School has had a strong year featuring important scientific achievements, significant expansion of our medical education programs, and meaningful engagement with communities across the Maritimes. In the fall, the medical school welcomed 12 additional undergraduate medical students, making the total class size at our Nova Scotia and New Brunswick campuses 124. As well, the Longitudinal Integrated Clerkship Program, designed to introduce medical students to practicing medicine in rural communities, expanded to the South Shore in 2020, following its successful launch in Cape Breton in 2019. Both of these are major successes in our commitment to providing quality healthcare to communities across Nova Scotia and complement the 4 longitudinal integrated clerkship sites at our New Brunswick campus. This year marks the 10th anniversary of Dalhousie Medicine New Brunswick. We are very proud of what our New Brunswick campus has achieved since it welcomed its first class 10 years ago. In recognizing this milestone, I offer my gratitude to DMNB's leadership and current Associate Dean, Dr. Jennifer Hall, to its first Assistant Dean for Research, Dr. Tony Ryman, who recently stepped down, and we welcome our new Assistant Dean for Research, Dr. Paul Atkinson. In November, we celebrated our amazing alumni at the first ever virtual Alumni Awards ceremony, which recognized the outstanding achievements in research and clinical practice and showcased the contributions of our Dalhousie medical alumni and what they have brought to our medical school and to the community. I would like to welcome Dr. Kathy O'Brien in her new role as president of the Dalhousie Medical Alumni Association and extend my sincere thanks to our outgoing president, Dr. Peggy Layton, for her leadership over the last 2 years. Under her guidance, alumni connections have grown and flourished. On the continuing education front, Dalhousie's Department of Emergency Medicine jumped into a leadership role early, developing airway management and education resources to support frontline clinicians dealing with COVID-19 across the Maritimes. To support clinicians caring for these sick patients, Dr. George Kovacs and colleagues quickly developed training practices in safe airway management and intubation procedures for frontline healthcare staff. I would like to recognize the tremendous work of our undergraduate and postgraduate education teams, and in particular, the enthusiasm and dedication of our students who have pivoted, adjusted, and provided constructive feedback to improving our education programs throughout these turbulent times. I would also like to acknowledge and thank our Med-IT team for the continuation of the faculty education activities would not have been possible without your efforts. On behalf of the entire medical school, I thank you. Our Assistant Dean for Graduate Studies, Dr. Valerie Chapp, has been working closely with the Faculty of Medicine Graduate Student Societies over the past year to improve the well-being of our graduate students. Because of her work and complementing the peer support network already established, we have recently appointed 2 faculty advisors to support graduate students and postdoctoral fellows, Dr. Eunice Anini and Dr. Leslie Ann Campbell. Another exciting addition to the faculty medicine roster is Dr. Angela Cooper from the Departments of Family Medicine and Psychiatry, who was appointed as the medical school's inaugural Assistant Dean of Faculty Wellness. In her new role, Dr. Cooper is providing strategic direction and leadership in the development of wellness programming for faculty members, ensuring our faculty have prosperous, successful, and enjoyable careers in Dalhousie University's Faculty of Medicine. The past 5 years have proven to be our most significant yet in terms of research funding, including over $70 million received by the medical school in 2020. I would like to thank and acknowledge the hard work of Dr. Roger McLeod, who will be retiring from the Faculty of Medicine in June 2021. As Associate Dean for Research, Dr. McLeod's leadership has contributed to the Faculty of Medicine's success in research funding. Dalhousie Medicine is so very proud to have such an amazing group of researchers playing a key role in the fight against COVID-19. The innovative work they are doing provides real-time results that can be used right here in Nova Scotia, throughout the country, and around the world. I'm exceptionally proud of all the research being done by our faculty across Dalhousie campuses, along with the work done in Nova Scotia Health, the IWK, Horizon Health, and PEI Health. Many scientists are deserving of congratulations for their continued research excellence. I want to single out a couple of the significant grants, including a Canada Foundation for Innovation proposal led by Dr. David Kelvin and Dr. Scott Halperin, who have recently received $1.2 million to advance the development of new COVID-19 vaccines and upgrades to the Canadian Centre for Vaccinology Level 3 containment facility at the IWK Health Centre. In addition to their CFI funding, Drs. Kelvin and Halperin received awards from the Canadian Institutes of Health Research totaling just under $1.5 million in funding for a special research competition to address research related to the coronavirus. As well, Dr. Shelley McNeil and her colleagues were awarded almost $1 million in CIHR funding to gather data related to COVID-19 symptoms. Additionally, Dr. Susan Kirkland is the co-principal investigator on a team of researchers awarded a $4 million investment in Canada's COVID-19 Immunity Task Force carried out by the Canadian Study of Longitudinal Aging. I remain very grateful for the support of the Dalhousie Medical Research Foundation and its efforts in supporting Faculty of Medicine research scientists. In terms of the medical school's commitment to serving and engaging society, 2020 has showcased the tremendous efforts of Dr. Omishore Dryden, the James R. Johnson Chair in Black Studies, Dr. Gaynor Watson Creed, Assistant Dean for Serving and Engaging Society, and Ms. Shauna O'Hearn, Director of the Global Health Office. In a year pervaded with social unrest, their leadership has helped guide the Faculty of Medicine's equity, diversion, and inclusion commitments and enhanced our community outreach. At our annual faculty meeting in June, a motion was passed to condemn all racism. This motion was made with the intent that the learning environment for all students be free from all forms of racism and instead be a safe and caring space to study and learn. With the assistance of Dr. Dryden and Dr. Gaynor Watson Creed, this year's annual Dean's Retreat held in November continued its focus on anti-racism and decolonialization within academic medicine leadership and discussed what further actions we can take as a faculty, department, and program to address systemic racism. In an effort to respond to the health needs of the diverse communities in our region, the Faculty of Medicine has been working hard to address enrollment gaps in the numbers of African Nova Scotian and Indigenous students entering and graduating from its programs. For the past 8 years, we have developed admission strategies to target recruitment from underrepresented groups with positive results. Spanning all 4 classes, the medical school is the most diverse it has ever been, and I am proud of our current efforts to recruit and retain such a diverse medical student body. My sincerest thanks to our faculty, staff, students, residents, fellows, alumni, volunteers, patients, donors, and community partners, everyone who is a part of the Dalhousie Medical School community, for your continued hard work that drives our success. Thank you for your support and dedication in these turbulent times. I'm very proud of your collective response in tackling the challenges of volunteering, teaching, mentoring, research, and patient care during this pandemic. I wish to extend my best wishes to everyone for a joyful holiday season and wish you a happy and healthy new year. With effective vaccines on the horizon, we can be hopeful that 21-22 academic year will allow us to resume more face-to-face activities. We all look forward to the opportunities to enjoy more camaraderie, travel, and togetherness. Wishing everyone the very best.